1 minute for everybody to get in. I am greeting you from the headquarters of Bajo in Washington. Before starting, I would like to mention that we have simultaneous interpreting services. If you click on your screen, you may select between Spanish and English. We also have sign language interpreters. You will be able to see them in your screen.
If you click on the globe at the bottom of your screen, you will be able to choose English or Spanish, whatever you prefer, as well as captions, and we'll have sign language interpretation that you will see on the screen as well. Bueno, y les invito, mi nombre es Prita Mónica Berza, la asesora de
My name is Prieta Mónica Berza. I am advisor of Bajo. When it comes to violence, I am part of the organizing team, and I work with Gustavo on disability advising and counseling. Thank you for participating in this event. We know that violence is still a challenge. We are within the 16 days of activism against gender-based violence, and it's a pleasure to talk to you related to the problem of women and children with disabilities. We know that the challenge of violence in our region is severe, and we know that the risk is high for women and children with disabilities. And what we want is to have a dialogue, have a visibility, because we know that many of you are involved in this. We know that this is not new, and we would like to invite you to share your knowledge, ask questions on the chat box, and I would like to invite you to introduce yourself in the chat so we could exchange the information that we know, what we could do together throughout this topic. And before starting, we are going to hear a welcoming video from Anton Hennes. He is the Director of Non-Communicable Diseases and Mental Health Offices, and this department also includes violence and disability within its scope. So we could start with the video now. Thank you.
Dani, no escucho el video.
Danny, I'm sorry, I'm not able to hear.
Mil disculpas a todos y todas.
We're sorry. We are trying to fix a small problem. Just give us a second.
No.
¿No se escucha tampoco?
No se escucha.
We're not able to hear now.
Bueno, quizás mientras tanto,
Well,
Gustavo, ¿por qué no
in the meantime, Gustavo, let's try to have an introduction of all of the experts that we have at the moment, and then we're going to continue with the video. Yes, I'm sorry, Brita. I'm sorry that this is happening live. And I don't know if this is happening because we have a poor weather in Washington. And as soon as it is available, we're going to have the welcoming words from the director. And like Brita mentioned, I am Gustavo Perez. I am the advisor on disability for for Pajo. And this is an opportunity which is relevant because we can join or merge two pieces of work such as violence That's why Brita is hosting a series of events. And tomorrow we have the World Day of People with Disabilities. So I believe that this is a great moment to merge these areas of work and provide the relevance that they deserve. That's why we have organized this webinar. We have a group of experts and panelists. I want to greet them and thank them for their availability in sharing their knowledge and all the information with us. We have Natalia Sofia Aduala. She is a technician and expert in the Committee on Rights Convention for People with Disabilities. We have Cristina Salcisco Reyes. She's the Vice President on the Latin American Network of People with Disabilities and their families, known as YADIS. And thank you, Cristina, for being here. We also have Marcela Tenorio. She is the Director of the Millennium Institute for the Care Institute in Chile. And we also have Gonzalo. He is the Director on Health Programs for Latin America and Special Olympics. I would like to thank you for your time, your availability. Daniela, I don't know if the video is available right now. Let's try one more time.
Bueno, no se escucha.
Seems like it's not. Well, now we're able to hear.
Buenos días y una cálida bienvenida a todas y todos a este importante encuentro.
Good morning and a warm welcome to all of you to this important event. We are tackling safe and inclusive environment, addressing violence against women and girls with disabilities. We are holding this meeting as part of the 16 days of activism against gender-based violence and on the eve of the International Day of Persons with Disability, which we are celebrating tomorrow. First of all, I would like to express my sincere appreciation for your involvement and commitment. Your presence here reflects a shared conviction that health, equity, and human dignity are universal rights that must be guaranteed for everyone without exception. In our region of the Americas, violence against women continues to be a widespread problem. According to the new PAHO and WHO estimates, 1 in 3 women have experienced physical or sexual violence. Around 90 million people in the Americas live with some sort of disabilities, and women and girls with disabilities face particularly high levels of vulnerability. They are up to 4 times more likely to experience violence by their intimate partners than those without disabilities, given that intimate partner violence is already highly prevalent in the region, affecting approximately 1 in 4 women. In the Americas, this introduces a major challenge. Violence against women and girls with disabilities can be physical, sexual, psychological, economic, or institutional. And it is often made worse by communication barriers, discrimination, and the lack of access to essential services and to justice. There is no excuse for violence. No form of violence should be acceptable.
Addressing this reality requires much more than simply acknowledging the statistics. It requires transforming the structures and environments that still exclude or render invisible women and girls with disabilities. It requires strengthening the capacity of the health sector to offer an inclusive and empathetic response, capable of identifying and supporting those facing situations of violence. And it requires addressing the underlying social and structural determinants that perpetuate inequality and violence. Violence in all its forms can be prevented, but this requires targeted action by all of us. We must work together to build safe equitable, and accessible environments in which all people, regardless of their circumstances, are welcomed and supported. We must intervene early, collaborating with families and communities to eliminate stigmas, challenge stereotypes, and promote relationships based on respect. And we must strengthen health services to be a trusted partner for survivors of violence, offering first-line support and quality care to all. Every action, every decision, and every accessible service contributes to this vision. At PAHO, we look forward to working with you all to raise the visibility of this important issue, to convene partners and collaborate with stakeholders across sectors and countries, to share experiences and document what works, and to strengthen policies and services so that they respond to women in all their diversity and prevent violence before it starts. Today, I invite you to make this dialogue a space for reflection, exchange, and action. I hope you will participate actively in the discussion. Together, we can move toward a future where no woman or girl is left behind and where all can live long and healthy lives free from violence. Thank you.
Muchísimas gracias al doctor Genis por darnos esta
Thank you,
visión tan
Doctor,
global
for
del
giving
futuro,
us
por
a
visibilizar
global
también el
view
compromiso de
and
la
by
OMS
visualizing the
contra la violencia
commitment
y
of
la
PAHO
discriminación.
against violence and
Bueno,
people
pues
with
yo creo que sin
disabilities.
más dilación
And
vamos a
without
comenzar ya con
further
las preguntas que
ado,
tenemos
we should
previstas
start with the
en este
questions
panel.
that we're considering in
Creo que
this
son
panel.
preguntas que en este caso
We
están
have
muy
questions
dirigidas hacia
that
el
are
ámbito de la
directed
violencia y la
towards
situación de mujeres y
violence
niñas con discapacidad.
and
La primera pregunta
women
va dirigida
and
para
girls with
Natalia Wala
disabilities. The
y
first
como es
question is
evidente,
for
¿por qué es
Natalia
una prioridad
Wala.
la prevención
And the
y la
question is, why
prevención
is it a
contra las
priority
mujeres
to
con
prevent
discapacidad?
violence
Adelante,
against
Natalia.
women with
¿Te la
disabilities?
repito
Natalia, you can
o...?
start. You want me to
Buenos
ask again?
días, ¿me
Bueno,
oís bien?
Maybe.
te oímos perfectamente, Natalia.
Muy
We're
buenos
able to
días,
hear you.
Gustavo. Bueno,
Yes.
buenos días
Good
a
morning,
todas y a
Gustavo.
todos.
And
Muchísimas
good
gracias
morning,
por
everyone.
la invitación
Thank you for
a reflexionar
inviting
sobre
me to
esta
reflect
temática que
on this
efectivamente es
topic.
lamentablemente, es tan importante
Unfortunately,
hablar
it
de
is
este tema.
relevant to discuss
Por qué
things
es una
related
prioridad,
to
¿verdad?
this
La
topic.
prevención de la
Why
violencia hacia
is it a
las
priority
niñas y
to
mujeres con
prevent
discapacidad?
violence against
Es
women
importante
and girls with disabilities?
y
Well,
lamentablemente sigue siendo importante
like I
hablar de este
mentioned,
tema porque
unfortunately,
800
we should
millones
talk
de
about this
personas
because
en el mundo
800
somos
million
mujeres
people in
con
the world
discapacidad.
are
Estamos
women with some
hablando
sort
de
of
una
disabilities. We're
población
talking about
que dentro del
a
ámbito de las personas con
population
discapacidad, los
within
800
the
millones
people
ciudadanos del
with
mundo,
disabilities. So it's
800
100
millones somos
million
mujeres.
people around the
Estamos
world.
hablando de más
800
de
million
una
are
de cada
women.
5 mujeres
So
en
that
el
means
mundo
that
son una mujer con
in only
discapacidad.
one decade,
Entonces estamos hablando
5
de un
women in the
número
world
importante,
are
¿verdad? De la
women with
población.
some sort of
No
disability. So
solamente
this is
por
a
una cuestión
large
estadística,
number, not only
creo
due to statistics.
que tenemos que detenernos en los
I
datos
believe
porque
that
lo que no
we
se
need
mide
to be
no se
careful
puede
with the data
asegurar.
because
Pero además de una
that of what you
cuestión
cannot
de
measure,
población,
you're
de la
not going to be
población,
able to
es muy
support.
importante trabajar
But
en la
beyond
prevención
that,
y
we
trabajar
need
en
to
la
work
atención
on
específica
prevention,
hacia las niñas y
care,
mujeres con discapacidad
specific
en el uso
targeted care
de las
towards
violencias,
women
porque
and
estamos expuestas
girls
a una mayor
with violence
vulnerabilidad
because
o
we're
unas
exposed to
situaciones
a situation
de
of
mayor riesgo,
vulnerability.
de mayor
We are in a situation of greater risk,
discriminación a la hora
of
de
greater
enfrentarnos en
discrimination
general a todos los ámbitos
when
de la
we
vida. En el
are
ámbito de la violencia
faced in
estamos,
all of the
decía,
areas of life. But when it
expuestas de
comes
manera
to
exponencial
violence,
a
we
diferentes tipos de
are
violencia.
having a strong exposure
Voy a mencionar
through
algunos de los
diverse
motivos que nos
types of violence. I'm going to
colocan
mention several of the
en
reasons
esa situación,
that put
como
us
decía,
in this
de mayor
situation of
vulnerabilidad, de
vulnerability
mayor riesgo
or greater
de
risk
sufrir algún tipo de
of
violencia.
suffering any kind of
Por un lado,
violence.
debido, como decía, a la
On one
interseccionalidad.
hand,
Estamos hablando de que las
we
mujeres
are
en general
mentioning that women
estamos expuestos
overall
a sufrir
we
todos,
are
¿verdad? Diferentes tipos
exposed to
de violencia.
suffering different types of violence,
A la
but
situación de las
when we're
mujeres
talking
en relación
about
a situaciones
conditions of
vulnerabilidad
women,
gracias a la
we should
discapacidad,
add
nos enfrentamos a una doble
vulnerability and
discriminación, a una discriminación
disabilities,
e
and we are
interseccional. En el ámbito
facing
de las
a double
violencias, ellas se
discrimination.
exponen de manera
And this exposed us
exponencial a largely to those type of situations. On one hand, this is linked to a lack of information, lack of awareness about our rights, about the right that we have to decide on our own bodies, and this is fundamental. What type of decision should we take if we are not accessing the information? Or with modalities of different communication or alternatives. So other type of situation that puts us in a great level of vulnerability is related to the situation of accessing different services, sexual and reproductive rights, for example. Sometimes people with disabilities, particularly girls, are considered as sexless beings. That means people that are not going to be able to be sexually active. It's like we're not fit to having families. So this exposes to situations of violence. So there's a sort of reduction of our abilities as women. We are not involved in sexual and reproductive rights. And the other face of the coin within this vicious cycle, which is unfavorable, by the way, for women and girls with disability, is related to vulnerabilities towards violence, precisely because we are objectified in a sense. Sometimes it is easily for us to be abused, and here it's important to refer to. You only have 1 minute, sorry. Yes, okay, I will be closing. And we're talking about different types of abuse, because sometimes women with disabilities in many countries, they are exposed to forced sterilization, and that puts women and girls with disabilities in a situation of vulnerability. And therefore, girls with disabilities would have to have any tool to defend themselves. And the last reason is the lack of information with people with disabilities. Sometimes if we want to report, the person that would like to, or that is suffering the abuse, is from their surrounding areas or people that are close to them. So we need to work in prevention due to all of the vulnerable aspects that we're exposed to. Thank you, Natalia.
Sí, gracias, Natalia.
Thank you, Natalia. And you also mentioned some of the connections or factors, and it's important for us to go deeper here.
Hablarnos un poco sobre qué factores estructurales, sociales, culturales o otros factores creen que más explican, más contribuyen a al mayor riesgo, a la mayor exposición de la violencia en
So which
mujeres o
factors
niñas
expose
con
women
discapacidad.
to
¿Qué factores debemos como
violence?
priorizar,
Which factors should
debemos
we
abordar para
tackle
comenzar con el trabajo de
in order
prevención?
to
Voy a
start the
comenzar con Cristina
prevention
Francisco Reyes.
work? I'm going to start with Cristina Francisco Reyes, and now we're going to continue with Marcela Tenorio. Cristina, you can go ahead. Yes.
Saludo a todos los participantes.
It's a pleasure. I would like to salute everybody. And like you're saying, this is a mix of all of the structural factors. And evidently, this is exclusive. Like, for example, social discrimination, the cultural norms, and the patriarchy that is subjacent in our region. So all of them together are contributing to violence. And whenever we're talking about these structural factors, we should be mentioning the lack of access to justice. This is fundamental. To be able to face, report, talk about any type of violence. And whenever we have such barriers, then we have a way of not letting information go through people, and the lack of access for mobility, transportation, to go through a prosecutor's office or any place where you can report this, for example. And we have discrimination, stigma, and the fact that women, or the fact that cannot report, or in a way that you could have been raped or subject to these actions, is something that goes with people and their families. The lack of reporting. And of course, we have these cultural patterns that are tied to this, where we're noticing that women with disabilities are not subject to violence. It is not visualizing some spaces, they're not punctual actions. And talking about statistics, unfortunately, we see that the organisms and where we're establishing patterns, it's just not in a disaggregated manner. Women with some hearing disabilities, and it's not visualized as an element. They're victims of violence. So that means that in our organizations, we need to make violence visible. When women and girls are being subject to this. So we know that all of these factors, unfortunately, are growing. Even if there's actions involved, unfortunately, we need a certain approach on the aspect that would generate for women, for gender violence women, gender violence stated actions could not be subject to this. So this factor is increasing. The silence, lack of visibility, infrastructure, the culture, all of these are factors that we need to focus on, and we need to try for this to be considered. Thank you, Cristina. Marcela.
Muchas gracias por la
Thank
invitación.
you for
Me tomo las
inviting
palabras de
me,
Cristina, a las que por supuesto
and
adhiero por completo.
I would
Siento que
like
ha señalado una serie
to
de factores
adhere to
estructurales que
Christina's
tenemos en
words. She
América
mentioned a
Latina
lot
y
of
el
the
Caribe.
structural
Y
problems that we
entonces de
have
lo que
in
dijo
Latin America and
Cristina
the
quisiera
Caribbean.
ampliar la
And to what
mirada a
Cristina
dos
mentioned, I
temáticas
would
que
like to
son
extend
fundamentales. Uno
this
es
to
el
other
elevado
topics, like,
estigma
for
que tenemos
example, the
hacia la
stigma
discapacidad
towards
en América Latina
disabilities
y el
in
Caribe, y
Latin America and the
particularmente hacia
Caribbean,
personas que tienen
particularly to
discapacidad
people
intelectual o del
that have
desarrollo o
any sort of
autismo. Este es un
mental
tema que desde el cuarto
disability
milenio de
or
investigación al cuidado hemos
autism,
venido
autism,
mirando desde hace
and
unos
we
4 o
have been
5
looking at
años
this for
y
4 or
tenemos
5
mediciones
years,
empíricas en
and
Chile,
we
en donde
have empiric
de la mano de la Iniciativa Global de Combate al Estigma y se
research
lidera desde
in
el Instituto
Chile,
College
and
London,
we
estamos
have
con mediciones
a
empíricas en el
University
terreno y
College
me refiero a
London
qué pasa
study,
con esta
and
expresión
we
de
are trying to
estigma,
see
y
what's
sabemos que
happening
el
with
estigma
these
en la región a lo menos
stigmas. We
triplica
know
y
that
se
in
ha
the
observado
region
en
this
términos
is
de estigma en
tripling,
países
or three
europeos.
times
Entonces
all the numbers
tenemos
that
un
we have in
tema
European countries.
estructural
We
de
have
actitudes y
structural aspects when
creencias
it comes to
respecto
attitudes,
a
ideas when it comes to people with autism. And of this information, we have collected this information. The general public, we are asking what's happening. We have prosecutors, notaries, lawyers, law students or practitioners, and we want to know if maybe professionally this is impacting this access, because sometimes women and girls in particularly, they're not reaching justice, particularly the people that have a multi challenges. This means that we could have somebody that has lots of disabilities, and that could be quite serious. And we also have the stigma that is expressed in judge and justice prosecutors more than people, regular people. So what happens? Well, direct contact is not working, or campaigns are not working because we are focused on having national campaigns, macro campaigns, and we're not adhering to what the evidence is showing. And we're only going to transform this if we do niche transformation, if we go through risk groups. We know that Caucasian heterosexual men of high educational levels have a higher stigma towards these groups, unfortunately, because they don't have contact in their education spaces. And when we know that this is further expressed, we know that we should train in niche as well. And we know that this is not working.
So, having said everything that Cristina said, we have a problem with the stigma that is real, and we have a problem in terms of accessibility. We are not working on cognitive accessibility so that the information can indeed reach the groups that need it. And I think with these 2 points, I would like to contribute. And this is related to what we're building through research. Thank you very much, Marcela. Gustavo, thank you very much. So we are identifying the factors that are really influencing. Now we're going to go to a more practical environment. Now, a couple of questions for Marcela and Gonzalo. The first question would be, can you share with institutional that make access to services difficult? Go ahead, Marcela. Yes, I'm focused. I will go back to my previous question. Let's advance to have documents in easy reading. Easy reading is a way that we adapt text so these can be navigated easily by people with intellectual and developmental disabilities and people with lower educational levels that maybe have a different native language. In Chile, we have a very significant group of migrants from Haiti. Their language is Creole, so creating easily readable documents, we're opening the door to accessibility to information that doesn't just address groups with disabilities, but also these other types of groups. And in the sense, I would like to say that we've done work through a consortium in Chile where universities and hand in hand with the government have advanced. So we have some laws for easy reading. And here in Chile, we had 2 attempts for constitutional processes. Both attempts were taken to easy reading to facilitate voting of people with disabilities. There is a team that is working on very interesting research that is to accompany that journey to vote for people with disabilities to see how they are able to access that citizen right that is fundamental to democracy. We have sustained work with the public ministry where we're advancing so that the different recorded interviews that are done in the country by law are accompanied by easily readable materials and other examples. But I would like to leave you with the idea that easy reading is not something done by normotypical people. It is built through a process of validation done with professionals with intellectual disabilities that are educated for this purpose. And we also have an interesting space there to have labor inclusion, where people with intellectual disabilities are able to do work that only they could do. So it's very interesting. We would not be able to do that work. So it's not that we're simplifying a task for them to do it, but we are recognizing the great role of social participation that they have in this process of democratizing information for all.
Muchísimas gracias. Adelante, Gonzalo.
Thank you very much. Go ahead, Gonzalo. Thank you, Gustavo, for inviting me. I agreed with everything that was said by Cristina and Marcela in their respective participations. Let's also remember some cultural actors that we have in our region. Our region is characterized by the machismo that exists, that holds that occupies an important segment of the problems for the population of women and girls. Let's remember that violence, from outside, those who are not involved in this can see violence as a physical violence or physical mistreatment, and these are the only mechanisms of violence that exist. But there are other mechanisms for violence, such as psychological violence or emotional violence, where people with developmental and intellectual disabilities are permanently being affected by those. What is not communicated is not seen. What is not seen is not addressed, not tackled. Whereas people with intellectual and developmental disabilities continue living in their homes where they're not allowed to leave because of different reasons. They live in the shadows permanently. This leads to an unintentional violence within their own homes, a violence, emotional violence, where they're not allowed to have an active life. We in the Special Olympics work on promoting social inclusion. We use sports as a mechanism or as an engine to include people with intellectual disabilities in society. But outside of the sports part, in the Special Olympics, we also have additional programs such as the health program that tries to promote health through an inclusive outlook, reducing access barriers to health services. And we go back to the same word, barriers. Barriers are fundamental. To get to know these barriers, we need to know them so that we can break through them to go to the next level, which is what we need. When we know the barriers, what we have found in our studies is that the main barrier that exists in health services for people with developmental or intellectual disabilities is that the healthcare professional uses those barriers, or they put that. And this is because of a lack of knowledge in how to work or how to address a person with developmental or intellectual disability. So here we have to work on education at all levels. Healthcare professionals have to take a step back and start realizing that what is in a book about signs and symptoms is not just what we should pay attention to. We need to pay attention to the whole person. And so we are working through the Special Olympics in training future professionals in addressing people with intellectual disabilities. We have to become aware of that easy language is something that we have to practice. We have to leave that technical language to explain what we're trying to say to people with intellectual and developmental disabilities. An additional point that we are working in the Special Olympics that significantly is in contact with people with disabilities and focusing now on women and girls is the safeguarding policies that we are disseminating, where all of the people that have in the Special Olympics relationships with athletes or people with intellectual disabilities should know how they should approach a person with intellectual disabilities, how to take care of that. And people with intellectual disabilities are told or are informed of how they could protect themselves, how they can raise their hand when they don't feel comfortable with some activity, so that we can take action.
Muchísimas gracias, Gonzalo. Adelante, Brita.
Thank you very much, Gonzalo. Go ahead,
Perfecto,
Britta.
muchísimas gracias.
Thank you very much. And we would like to continue talking about the health sector. As you know, a priority in PAHO is working with the ministries of health to improve the quality and capacity of health services. Evidence suggests that all women and girls at some point in time will come into contact with health services, and this contact is an opportunity to offer a quality service. So I would like to hear from you, and I'm going to go to Cristina and Natalia to talk about, in your opinion, what is the role of a health system to respond to violence against women and girls with disabilities? How should health services do? What should healthcare professionals in those primary care healthcare services do? Cristina? Yes. Yes, the health sector should become a key stakeholder to act in a prevention, early detection, and accompaniment. Why? Because when we talk about physical violence, we are saying that this is the first point of contact. When you're going to get treatment or to address that violence. So detection and registry should be a factor for the justice system and for all of the other stakeholders that should eventually get involved. Unfortunately, it is not so. In the Dominican Republic, very recently, we had a project, and in turn, through this project, we carried out some research with the health sector to see how this was being addressed and how they were helping women with disabilities. And through different focus groups, we found many, many barriers. And even though we know them, we were able to produce evidence about them, because there is no list. For example, if a woman with disabilities comes to the health service, if they are registered, but they're not entered into the documents to register that. So in the documents, there is no part where you can record a disability. So, as Gonzalo and Marcela said, what we don't see, what we don't record, generally is not perceived, and therefore is not directly and correctly addressed. So we have to have that key factor so that we raise awareness in health. Awareness and also the responsibility to register the violence in a statistical manner when it's suffered by women and girls with disabilities, because then this will lead to have coordinated work with justice and the different instances that would receive those reports. But also for those who build public policies for prevention, which is the main thing to make sure that violence does not continue directly affecting women and girls with disabilities. Especially if that violence is not physical, it is still a violence can produce problems with mental health. So it is as serious as physical health. Mental health is deteriorated because women with disabilities do not receive the support, the attention, or accompaniment to be able to report the violence. So I think the health sector is key. The health sector, when they receive physically or because of physical or psychological violence, they receive this through health processes, we can say that this will be an ally, a key element to detect, face, and report violence from the medical or health sector outlook. Thank you very much, Christina. I see that there are a lot of comments in the chat about detection and visibility and documenting cases. Natalia, what should healthcare service personnel do to support women with disabilities that are at risk of violence? Thank you very much, Britta. As Christina was saying, the ministries of health or the health sector in general should have that role that is key to detect and document and even transfer not just the reports but also the attention to situations of violence. And I would like to say that it's not that just that they could have this role, but they should, because the ministries of health are part of the government. They're part of the state's responsibility, the state that ratified the Convention on the Rights of People with Disabilities. It's not something that should be debated. It's an obligation of the states, and therefore the ministries, especially in health, have the obligation first to provide attention with a social paradigm for people with disabilities, and I think there's a challenge there. And then going back to the attitude barriers, if we don't invest in informing healthcare personnel to change the perceptions that they have of people with disabilities and of women and girls with disabilities in particular, it will be very difficult to receive quality service in where we have the condition to be able to decide over our violence. And institutional violence is something else that we have to look at. And in health sector, there's institutional violence such as forced sterilizations or coerced abortions that are practiced in healthcare sector, because there's an understanding that women and girls are not apt to make decisions on their bodies or to have families. So it is fundamental to invest in information, to produce laws, to eliminate these practices that are violations of human rights and the Convention of the Rights of People with Disability. And then we have to inform the health sector also in attention in having reasonable adjustments and supports in healthcare services that would be received by people with disabilities. The previous panelists said that each person, according to their needs, not their type of disabilities, but their needs, will require certain support, will require certain reasonable adjustments to be able to access health and to be able to enjoy health care services under equal conditions. But healthcare services are not prepared from a physical point of view, accessibility or communications. For example, a deaf person that wants to receive information about their sexual health or about their health situation, they require support. A person with intellectual psychosocial disabilities requires a service, healthcare services just like any other person. So we should not have this perception of infantilization or saying that we will not be interested in their health or to make decisions on health. This should be changed through public policies and investment. And of course, no public policy is successful without an assigned budget. And then finally, it is the relevance of recognizing the legal rights of people with disabilities so that all of these are possible. And as was said before, document and to be able to have information is fundamental to be able to transform public policies into effective public policies. We would like to thank both. Gustavo? Well, very well. I think that we have a pretty global context on identifying structural barriers and the roles of decision makers. But I think we are still missing the most important part of this question, and this is for Gonzalo. What is the role of civil society organizations to respond to violence against women and girls with disabilities? Go ahead, Gonzalo. Thank you. And going back to what the previous speaker just said, and going back to health, education is important. Education, it means an adequate education for adequate communications, and this could change the world. The first message coming from the institutions where a person with disabilities is born, where they get their services, the information that is provided to those parents will change the future of that person with the disability. Here we have to work on a new education of the future healthcare professionals. I think this is very important, and this is where civil society or civil society organizations have a fundamental responsibility. Educators of the future healthcare professionals have a huge responsibility. The universities, the technological or technical institutes that educate future technicians and professionals that will be working with people with disabilities have to understand that they are working with people. People have conditions, but we're not treating a condition, we're treating a person, and this is what we have to work on. Each civil society organization, each institution will have its own responsibility in its own sector, but we definitely have to work together, repeating what has been mentioned before, and that is to make things visible, making the person visible, removing that label that the person with disabilities has. We have to remove that label that is fundamental. We have to put the person with a condition, not a disabled person, quote unquote, as we talk in many environments. And here we go back to the institutional violence that was just mentioned, that is very important. The school bullying exists, and it directly affects people with disabilities of all kinds, not just intellectual or developmental. All people with disabilities are affected by those abusive entities that exist in schools, and because of a lack of education or understanding of a disability, they become aggressors. The aggression that exists within homes, within the families, is important. That aggression or that violence that exists because of a lack of knowledge also has to be addressed by civil society organizations and institutions. We in the Special Olympics are working with training healthcare workers, the ones that have the first contact with the people or families in the communities, preparing them, making them part of the team to open the door of a house to have a person with disability be able to live safely and also to be able to live fully. So to finish, civil society organizations have to come together. We can't work in silos. We have to work together structurally to favor people with disabilities. This is fundamental. If we're not able to do this, if we're still divided, each one will be, I don't know, pulling water to their own mill, but we will not be able to achieve the results. Thank you very much. Thank you very much, Gonzalo. Go ahead, Britta. Thank you very much, everyone. I'd also like to thank all of the people that are adding comments and suggestions and ideas in the chat. In Pajo, we will be reviewing everything that has been mentioned during the session, and we will look at all the ideas and suggestions in the chat so that we can continue working on this topic. This event falls in a week that has a lot of activities, the International Day of Disabilities tomorrow, but in Pajo, we're very interested in continuing the work and the dialogue with all of you on this topic, so that we can provide visibility to this topic. In this topic, we have a video and a new leaflet that is being added to the chat. We invite you to check these and to disseminate the material. And let's think together about what else we can do. And in fact, that is my suggestion or my last challenge for all of the speakers, and I say also for everyone who is connected. I invite you to think about one thing, one concrete change, one action to implement tomorrow. One change or one action, one suggestion, one priority. And we will have a round of speakers. And all of those who are connected, we invite you to add this one thing in the chat, one action that we could implement tomorrow to change the situation so that we can produce this change. We will have a round, and since I see Natalia, I'm going to go with Natalia. A suggestion, an action, or a change. I will share a resource guide for the Spanish-speaking region of practices that are being carried out in different countries that can be scalable. I think this helps us address prevention and detection of violence, and it helps us enact what we are talking about. Thank you. Christina? You're muted, Christina. Sorry, I had disabled my audio. Okay, I think connection is key. Connection between each one of the stakeholders that are working on facing, preventing, or acting on violence. It can be justice, health, government, civil society, and family. I think having connection amongst all these can help us. Thank you very much, Cristina. Gonzalo? I would like to repeat what Cristina said. Articulation or connection. Connection amongst organizations with a clear concept, a working structure with an action plan looking towards the future, and removing the blindfolds, helping others remove those blindfolds that make people with disabilities invisible. Perfect. Thank you very much. Marcela?
Está muy complicada la pregunta.
I think that's a complicated question. But I will say that I think that one action that we can implement, that we are implementing now, is to make sure that we have people with disabilities in the first line that are included. The people with intellectual disabilities have to be included. Those of us who have the privilege of being in these platforms, we need to open these spaces for their participation of their voices, and this will enrich our experiences. And I will leave the presentation of Mikare in the chat. This is the first professionalized office in the region where a group of spokespeople with intellectual disabilities are participating as co-researchers in processes to build and develop knowledge. I think this is an interesting path and something that we should explore, and we hope that we can have the wills of Special Olympics and other civil society organizations to include people with disabilities in their boards. Thank you very much. I'd like to thank everyone. I'd like to thank the participants for their comments in the chat. I'd again like to thank all of you for your participation in this event and like to invite you to continue collaborating with PAHO and others to continue providing visibility to this topic so that we can together think of what we can change. And with this, we go with Gustavo so that he can close out the session. Thank you very much, and I hope that we can continue the dialogue in the coming months to provide visibility to this topic to work together. Thank you very much, Brita. Thank you very much, everyone who participated, all the speakers. Thank you for the Riyadh, the Once, and the Special Olympics. Thank you very much. I'd also like to thank the excellent speakers for giving us their time and knowledge. Thank you for helping us understand what we can do as a society so that we can improve the situations of violence that women and girls with disabilities suffer. I'd also like to thank the interpreters team and the communications team for making this webinar a reality. And of course, we would like to thank all of the participants that connected that have provided very interesting comments. Today, we have reaffirmed that violence against women and girls with disabilities is not is due to structural inequalities that can be produced in different environments, and they require laws and structures that can put the person at the center of their policies. We have to invest in incorporating the disabilities outlook in the response to violence against women and girls with disabilities. We have to make sure that services are safe and accessible. We have to invest in training healthcare professionals so that they can respond to the different situations. And lastly, have disaggregated data to inform effective policies. Once again, thank you very much, everyone, for participating. Hope to see you soon. See you next time.
Muchas gracias. Chao, chao.